healthy population and strong healthcare systems are important for every country and are key socioeconomic indicators of national development. This is the first in a two-part series of Government in Action in which we take a look at the health sector and work that is being done to promote and protect the health and well-being of all Guyanese. A healthy population lives longer, and this in turn leads to more productivity. Providing adequate health services to the population, therefore, is a paramount goal for the government. President David Granger has said that the provision of quality health services is part and parcel of raising the quality of living for Guyanese, thereby achieving his administration's goal for the good life. But a country's ability to provide quality health services for its people is dependent on many factors. A healthy society must come as part of a combined effort of several stakeholders. In May this year, at the launch of the Health at 50 in Guyana Progress Health Report of the Pan American Health Organization and the Ministry of Public Health, President Granger noted that while public health is the responsibility of the state, it is a matter that cannot be solved by the state alone.
Central government must work closely with the 10 regional administrations, and the regional administrations in turn must work more closely with the municipalities and neighborhoods, and that is why local government elections are so important, to make sure that all of these elements are in place.
The regional distribution of services is just one of the main focuses of the Ministry of Public Health. The ministry's work is divided into 7 core programs which make up a holistic approach to the administration, monitoring and improvement of national health care. Minister of Public Health Dr. George Norton said that easy access to quality medical care is a constitutional right of the people. To this end, there have been a number of recent improvements and additions in healthcare facilities and services throughout the country. In the Barima-Waini region, plans are well underway for the construction of a $700 million regional hospital in Port Kaituma, which is scheduled to be completed in December of this year. The Bartica Hospital in the Kiyuni-Mazaruni region has recently been transformed into a regional hospital, resulting in an overall improvement in the range and quality of services and a 50% reduction of referrals to the Georgetown Public Hospital Corporation, GPHC. During a visit to the facility in May, President Granger said that with Bartica's new township status, there must be a full list of services accessible to the people.
No resident should have to leave his or her region in order to have access to the public services. All of this fits in together, fits into the great plan to have this region as a place where our residents, our citizens, our children could grow up in safety and comfort and enjoy that good life.
Meanwhile, plans to ensure that the Lethem Hospital in the Upper Takatu, Upper Essequibo region is also recognized as a regional institution were announced in August this year. These and other initiatives aimed at decentralizing health services among all the regions in Guyana are high on the ministry's list.
While the idea of having that main referral institution at the Georgetown Public Hospital, we must be able to offer a quality of health care where the diagnosis can be made and the management of that diagnosis is available, and the person must have access to it.
Among the primary focuses of the Ministry of Public Health is maternal and child health. Within the family planning program of the ministry, the Maternal and Child Health Unit holds the responsibility of ensuring that women, children and family members obtain maximum health care that is necessary for their growth and development. Within its focus lies as a priority the reduction of maternal and child deaths.
We want to aim at 0 maternal deaths, 0. Not just reducing the deaths of our babies, but 0. There should be no reason in 2016 why babies have to die.
Director of the Maternal and Child Health Unit, Dr. Ertanisa Hamilton, said that while guidelines are in place with regard to all aspects of maternal and child health, the implementation of these is key. The unit is therefore focused on the training of all healthcare professionals at every level on the proper administration of healthcare services in this area.
Over the past years and this year also, we would have worked on training our healthcare providers in what is called the integrated management of childhood illness. This looks at all the different childhood diseases and what are some of our danger signs. We take it very seriously that even the lowest healthcare provider needs to be able to identify what is wrong with the child so that they can make a diagnosis and so that treatment can be in place. So far, we've been able to train at least 60% of our community health workers, which is our main focus as it is right now. All of our doctors are trained, especially our new graduates from the Guyana Cuba Scholarship Program. And so before they go into the hinterland, we try to make sure that this is one of the areas that they're training. We also have the obstetric emergency training, and that has to do with identification of all obstetric emergencies and determining what treatment needs to happen and when to refer. This is also what we do for all of our graduates, and we have now even tailored the program so that our community health worker has a place in getting their information and their training. We have also started working with the Latter-day Saints on a program that is called Helping Babies Breathe. Very important, and for Guyana especially, because for our neonatal deaths, our main cause is actually prematurity. And getting our health workers equipped with the necessary knowledge on how to actually save a baby before transferring them to the neonatal intensive care is one of the important areas where statistics would have proven along the years we had difficulties. So that is something we have started working on.
Other programs aimed at improving maternal and child health include an immunization program and the increase in postnatal visits to new mothers.
Guyana would have benefited from a loan that will be coming on board shortly from the IDB that will be looking specifically at maternal and neonatal deaths. And this loan looks at all the different areas, and one of our very big challenges has to do with our hinterland areas. And so for that those particular regions, we're looking at a community approach. Getting all of the persons on board is very important for maternal and child health. We need every neighbors to be their neighbor's keeper and to inform us, the healthcare providers, so that we can make decisions and so that we can act early.
Dr. Hamilton also credited partnerships with organizations such as the Pan American Health Organization and the United Nations Children Fund for many of the programs that are ongoing so as to ensure proper health care is administered to mothers and children countrywide. Minister Norton has also welcomed other improvements, such as the Ministry of Social Protection's advocacy for 6-month maternity leave for mothers, which has been suggested by the Public Health Ministry.
We are promoting 6 months breastfeeding and only breastfeeding, and I can say that it at times can be really uncomfortable, almost impossible for mothers to only breastfeed their child for 6 months when they're only given 3 months of maternity leave. In Canada, it's 1 year, but we want to go further than that. We don't only want to increase the maternity leave in order for the mother to breastfeed, but we want a serious look into the possibility of even having not only maternity leave, but paternity leave as well.
The GPHC has also seen a recent expansion of its maternity ward. Acting Chief Executive Officer Dr. Shikamir said that a facility, which is mostly complete and will soon be commissioned, makes provision for a neonatal unit and an emergency area for gynecological patients, among other key health needs. The GPHC remains the central health institution for the country. The facility holds many hats. First, it serves as the primary hospital for both the city and the Demerara-Mahaica region. It also serves as the National Referral Hospital as well as the National Teaching Facility for medical students. Minister Norton said that the GPHC has come a far way with regard to the delivery of medical services, but attests that more work has to be done in this regard. Dr. Amir said that the institution holds several partnerships with overseas organizations and universities that aid in the administration of specialized healthcare services. Added to infrastructural enhancements, these and other administrative factors aid in the overall improvement of the capacity and quality of service that a GPHC can provide to its patients, Dr. Amir said. However, the hospital has repeatedly come under scrutiny for shortcomings, among which include waiting time at its accident and emergency unit. Dr. Amir said, however, that the structure of the unit provides for categorizations of incidents which result in cases being treated according to priority.
Patients are categorized: what is immediate, what is urgent, and what is non-urgent. Immediate always takes priority. Gunshot wounds, asthmatic attack, cardiac problems, those are immediate. Nobody has to wait. Urgent would be like the pain, certain belly pains and some other issues. Non-urgent would be the person with a pain for 2 weeks and just deciding to come today. A cough and a cold, they're not. And we try to stick within these categories, and people feel slighted when they see somebody else going after them and being treated before. But it's a category they were triaged in. And this is not unusual anywhere else in the world.
Categorizations of incidents aside, Minister Norton acknowledges that there are other issues that result in further shortcomings for the facility.
The inpatient facility that we have there is now offering less beds per se than what existed before. So while we have a new building, that is not sufficient, and hence the situation we have now of patients being 2 days at accident and emergency department who are admitted and can't find a bed because you broke down a system with, let's say, over 1,000 beds and you put one with 800 beds. That situation needs to be corrected, and I think that we have to go back to that exercise that was done before of using the advice and the recommendation of the consultant that decided on the best way forward.
The minister said that looking into such issues have become a priority for the ministry, and while some efforts have begun, further work to improve the hospital will be made possible through budgetary allocations and other initiatives in the near future.
We've got to look at the Georgetown Public Hospital in a long-term basis, and I think that what we have there is a work half done. There is space, there were plans for it to extend further, and we have to seriously look at it. If not, we'll continue to have the accident and emergency department becoming a holding area rather than having those patients there go on the ward. And it is not good. We're not happy about it. We recognize that there are problems, and we're going to change it.
The minister stated that his ministry is committed to ensuring that all areas which may not be up to required standards within the health sector are addressed to ensure that all Guyanese are able to access adequate health services. On next week's episode, we continue with the Ministry of Public Health with a focus on other matters in family health, disease control, rehabilitative services, and other programs aimed at improving the overall health services for all people of Guyana. This is Jasmine Payne. Thank you for joining us.